Yeah.
Hello and welcome to another episode of Which Disease Is It Anyway? A game show where the rules are made up and the points don't matter. I'm your host, Forrest, and joining me are my three contestants, Jane,
Hello.
Bree,
Hi.
and Kayla.
Happy to be here.
Well, folks, for those of you who are new to our show, the game is simple. I am going to rattle off some information about a patient, as well as some laboratory results and examination findings. And my contestants here are going to buzz in by raising a hand, either with questions or guesses. I will answer the questions with my sheet, and the contestant to correctly assess what disease our patient has first is the winner. With that being said, let's get started. We begin with Carol Brown, a 32-year-old woman presenting at the clinic with chronic lower back pain. She states that it was aching recently for about a week or so she decided to come in for an assessment. Pain is currently rated on a scale of 3 out of 10 and a dull ache. Yes, Bree.
Do we know if this patient has any history of back injury or surgeries?
Yes, Kayla.
On that note, do we know if the patient does any strenuous physical activity at work?
And yes, Jane.
Is she complaining of any other pain or nausea?
An excellent set of questions all around. To answer, the patient reports mild nausea accompanying her back pain. She denies any history of surgery or injury, and our records do not indicate that for the 4 years she has been seeing us in clinic, that would be incorrect. Finally, she is a school teacher who religiously lifts with the knees only. With our first round of questions down, the contestants will now have some time to discuss.
Okay. So, the lack of physical etiology of the injury combined with the nausea leads me to believe that this is gastrointestinal in nature.
Yeah, I agree with you, Kayla. I think we're going to need a little more information before we can come to any conclusions. I hope we get some more information in the health assessment portion.
Yes.
Yeah, because if we're looking at this objectively right now, an abdominal assessment would be the most appropriate step. So,
Yes, Bree?
how were the patient's head-to-toe findings?
I am so glad you asked. Now that our discussion has resolved, we're going to move on to the second round of the show, the head-to-toe data portion. Contestants, your instincts are good so far. Abdominal assessment demonstrates clear inflammation and pain upon palpation of the upper right-hand quadrant of the patient's abdomen. But otherwise, the abdomen is clear, smooth, round, and non-distended. This does come with a handful of curveballs, though. The patient's skin and sclera are clearly yellow, and although they have an oxygen saturation of 92% on room air, their respirations are down to just 10 a minute. For context, Mrs. Brown normally sits at around 16 a minute while in clinic. Yes, Jane.
Could it be appendicitis? What's the white blood cells count on the blood test?
White blood cell count is currently sitting at about 9,500 or within normal limits. No fever is currently present, and the temperature is 97.6 degrees Fahrenheit.
So appendicitis partially explains the pain and upper quadrant pain.
Yeah.
But the pain is too low and it doesn't explain the jaundice of her skin and sclera. And it also isn't sharp, and we have no other signs of infection.
Mm-hmm.
Good point, Bree. Does the patient have a history of drinking?
Unfortunately, no. No alcohol consumption on file.
Oh.
Yes, Kayla.
Do we have any data on stool? Is it soft, hard? How many times a day is she going? I think I have a hunch.
That is a very good question. The patient relayed their last stool movement was this morning, but it was, and I'm quoting here, the color and texture of a lump of clay. Additionally, the patient reports that their urine was dark brown. With our second round of questions in, let's break for a little more discussion.
Okay. I think the clay-like stool is a good lead that indicates a lack of bile in the digestive system, which means we are getting closer to our answer.
Yes, but I'm still unsure on a few specifics, but I feel like we are getting in the ballpark.
Yeah, I agree too.
Well, contestants, don't get too comfortable. Round 3, as you know, if you've been on the show before, is our curveball round.
Ugh.
While you were out charting, the patient has emesised into a nearby garbage can, largely white and yellow fluid material, reports an increase in nausea, claims to be extremely fatigued, and has been admitted to our general medical floor for monitoring. According to your physical examination findings of the patient, as they had recently been in for their physical, they are also down 6 pounds in the last 2 weeks. A new battery of test results have rolled in, and your patient is stable for now. Yes, Bree.
Wait, so you're telling me this patient has fatigue, nausea, unexplained back pain, and weight loss?
Yes.
Good grief.
Yes, Jane.
Hold on. Does the patient have any genetic discrepancies?
Oh, yeah. That could lead us to our culprit, given the location of pain and new symptomology.
Well, given that incisive question, Jane, I think the cat might be out of the bag. Yes, after some testing, you have discovered that the patient has not one, but 2 genetic mutations. One in the KRAS gene and one in the TP53 gene. For some additional bonus points, do you mind informing the audience what those are?
Sure. Well, the KRAS gene is a mutation that leads to unmediated cell growth.
And TP53 is a gene regulator that regulates cell cycles. If it is abnormal, though, it can lead to the loss of cell cycle growth regulation, leading to unmitigated cellular growth.
Good point. And KRAS is present in roughly 90% of
Pancreatic cancer patients.
That would explain the jaundice, bowel, duct obstruction, the back pain, and the other unexplainable symptoms right above the cogent swelling.
Well, folks, it seems that we have come to the conclusion and found our answer. Yes, after some additional testing, you have determined that the patient does show high-grade pan-in lesions, and the patient has been diagnosed with malignant desmos plasticized pancreatic cancer. And that tumor is particularly nasty due to its desmos plasticization, because that means that it is chemotherapeutically resistant. But wait, isn't there something that we're forgetting? For bonus points, why don't you tell me what you missed?
Oh,
Yes, Kayla.
the breathing?
Could you be more specific?
Oh,
Yes, Bree.
with pancreatic cancer, distant mastitis can occur, and it can even go all the way into the lungs.
Oh.
Yes, Jane.
Which explain the oxygen saturation and respiration discrepancy.
These 3 contestants remain as sharp as ever. Yes, for the additional bonus points, you have correctly assessed the clinical findings that would suggest distant metastasis or metastasis to the lungs. And since you all answered previously together, you are all our winners. Congratulations. And that's all for this week of Which Disease Is It Anyway? As always, I'm your host, Forrest Winstead. Thank you for joining us. Thank you for my lovely contestants, and we'll see you all next week for more medical mysteries.